Hello, and welcome to the learning series titled Learning Together, Delivering in Uncertain Times. Please note that this session is being recorded. We're pleased to offer French simultaneous interpretation for this session. If you wish to hear the voice of the interpreter, please select French from the interpretation menu at the bottom of your screen. If you need support at any time during the webinar, you can reach out to one of our producers using the chat feature. My name is Lindsay Yarrow, and I'm the Senior Improvement Lead on this program, and I'm really excited to be joining you today as co-host for today's webinar. I would like to start by acknowledging that we are meeting on land that has been inhabited by Indigenous peoples since the beginning. In particular, I acknowledge that I am hosting this webinar from Kingston, Ontario, which is the traditional and unceded territory of the Haudenosaunee and Anishinaabe people. We recognize and deeply appreciate their historic connection to this place and the opportunity to gather here today. At Healthcare Excellence Canada, we continue on our learning journey and commitment to support improvement with and for all people in Canada. Healthcare Excellence Canada represents the newly amalgamated organizations of the Canadian Patient Safety Institute and the Canadian Foundation for Healthcare Improvement. We work together with patients and other partners with a goal of delivering lasting improvement in patient safety and experience, work life of health providers, value for money, and health for everyone in Canada. We are an independent, not-for-profit charity funded by Health Canada. We are pleased to share that this program is delivered in partnership with the Canadian Centre on Substance Use and Addiction and the BC Patient Safety and Quality Council. Today, I'm excited to be joined by my co-host, Ryan McCarthy. So Ryan, before I get too far into today's event, I'm wondering if I can hand it over to you to introduce yourself.
Certainly. Thank you very much, Lindsay. My name is Ryan McCarthy, and as mentioned, I'm the Director of Knowledge Mobilization at CCSA, and we're pleased to be working with our colleagues at Healthcare Excellence Canada on this initiative.
Thanks, Ryan. I also want to introduce our other speakers for today's event, Grace Rashandi and Tina Kaur. Welcome to Grace and Tina. Grace, I'm going to hand the mic over to you first virtually so that you can introduce yourself.
So hi, everyone. It's a pleasure to meet you all. My name is Grace, and I'm the Population Health Coordinator for the Population Health Services at the Inner City Health Associates. And I'll pass it along to Tina to introduce herself.
Hi, everyone. I'm Tina. It's nice to meet you all as well. I work with Grace as part of Inner City Health Associates, and I'm the Population Health Nurse.
Great. Thank you both. And we look forward to hearing from you shortly. But before we hear from Grace and Tina, we did want to share a bit about the background of this program and what we heard from organizations across the country so far during the development phase. So in the summer of 2020, one of the programs that we began delivering was the Long-Term Care Plus Acting on Pandemic Learning Together. The program brought together long-term care homes and retirement homes across the country to strengthen their pandemic response in 6 key areas that you'll see on the screen. The program provided coaching, shared learning through webinars and huddles, as well as seed funding for organizations to use where the need is greatest to support pandemic preparedness and response. Ultimately, what we heard is that there's a need beyond these facilities, and this resulted in the decision to expand the programming model to emergency shelters serving those experiencing homelessness, as well as residential substance use facilities. We're committing to working with those working in this sector to identify ways that we can support knowledge sharing and learning. For those of you who have applied for seed money, you've shared a number of areas that you were interested in learning more about. And Ryan, I'm happy to hand it over to you to walk through this a bit further.
Thank you, Lindsay, and thank you to all of you who took time to share your knowledge needs and provide us with some guidance on areas that are of concern that we will aim to address today. We wanted to provide a high-level overview of what we've heard so far. We wanted to touch on some of these areas in more detail, starting with infection prevention and control. One of the most prominent themes we have heard so far is the need to ensure the safety of clients, staff, and families during this time. There is concern about how to prevent outbreaks in treatment facilities and how to manage outbreaks when they happen with a safety focus in mind. People also want to ensure that there is a consistent and sufficient supply of personal protective equipment, or PPE, and that there is guidance on its appropriate use. Given the continually evolving nature of the pandemic, it is important to people that PPE is ready and available to ensure the safety of clients and staff. People are also concerned about ensuring clients have consistent access to quality services in the event of an outbreak. Given programs and services have had to pivot quickly to adhere to public health guidance and protect those they serve, there is concern that quality may suffer inadvertently. This also includes a large component and interest in planning for quality improvement by manualizing or documenting a consistent approach. People also wanted to learn about strategies to continue to provide on-site services given the need to ensure consistent services for the clients they serve. This includes overdose prevention services. Many respondents felt that it was important to strategize early about how to ensure consistent services and access given the continual uncertainty and disruption during this time. Respondents also wanted to learn about how to ensure there are services close to those that they serve, to ensure people do not get lost in the system or do not have access to needed programs and services because of changing public health regulations and having capacity reduced because of public health measures such as social distancing. This is especially important to ensure continuity of access. One area that was significantly highlighted throughout our respondents was staffing, as there is concern about how to manage the needs of staff while balancing the need to provide services. Areas of concern that came out include ensuring and enhancing the psychological health and safety of staff. There's a recognition that staff are dealing not only with the demands of providing services to those that they serve, but also balancing their own work and personal demands during this challenging time with the pandemic. Another area that participants were very eager to learn about was planning for surge capacity. What models or approaches of planning can be used to ensure that there is adequate staff to meet the needs of people, while at the same time ensuring the safety and well-being of staff, clients, and families. There is a desire to learn from colleagues about how people are planning for staff demands with limited resources and dealing with significant demands on programs and services in an already strained system. And burnout continues to be an issue of concern as staff are working continually to innovate programs, deal with uncertainty, manage already significant workloads in addition to their own experiences and needs during the pandemic. While things continue to fluctuate and cause uncertainty, many are concerned that staff are experiencing burnout, which also leads to retention issues affecting the quality and programs of services available. As the pandemic has forced us to look at different models of providing services and programs, this is an area that has been raised by a number of respondents. The first is how to ensure consistent access to programs and services in a virtual world. In a time where groups cannot convene in person, how do we ensure that there is consistent access and quality in a virtual care environment, especially given that not everyone has equal internet access? Having said that, there is also interest on innovative ways to deliver services that were formerly delivered in person, understanding that public health guidance is likely to continue to change and evolve over the coming months. Respondents expressed a desire to learn more about how to innovate to ensure that people are getting the services and programs that they need, and to do so in a way that may actually increase the reach. And last but certainly not least, respondents indicated the need to learn about how to prevent and manage burnout again. They understand the increased pressures of providing services and programs in this unique environment and ensuring work-life balance. And now I'll turn it back over to Lindsay, who will highlight the other two areas of the survey.
Thanks, Ryan. Adding to what you shared, we also heard a lot from teams about the impact that vaccination has had on their work. So this includes the best way to support clients and staff in accessing vaccination clinics, especially when they're off-site, how to ensure individuals get information about the benefits of vaccination, and how to track delivery in locations like substance use facilities and shelters where the length of stay may be short. And Grace and Tina, we're looking forward to hearing more ideas from your team on this, as we know you're working to support vaccination efforts. We also heard about supporting families and questions about how to best support their families when their loved one is accessing treatment. This can include limited access due to visiting restrictions, but it also includes the reality of services provided away from family and friends and caregivers, and how to ensure that that access continues and the supports remain in place. So encourage you to continue sharing any thoughts or comments that you have in the chat box. We would love to hear your thoughts, and all of this will be used to help us as we design the next stages of this program. We'll continue the conversation a bit further at the end of the webinar, but without further pause, I do want to hand it over to Grace and Tina to share more about their exceptionally important work happening here in Ontario through the Population Health Program. So Grace, over to you.
Thank you so much, Lindsay. So I'm very excited to talk about the population health services at the Inner City Health Associates. And I just want to acknowledge first the land in which I'm standing in, which is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people. And it's now home to many diverse First Nations, Inuit, Métis, and Métis people. I also acknowledge that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaty signed with the multiple Mississaugas and Chippewa bands. With that being said, I'm going to move on to talk about the outline of this presentation. So we're going to talk about who we are, what we do, which involves COVID-19 prevention and mitigation, health promotion, and immunization planning, which all seem to be important components that were touched on in the previous conversations. We're also going to talk about working with people with vulnerabilities and our experiences and our approaches in that front. I'm also going to be talking about our long-term goals and addressing any questions you may have. So I'm going to pass it along to Tina to talk about who we are.
Hi, everyone. So as I mentioned at the start of the presentation, I'm Tina, and I'm the population health nurse as part of ICHA and as part of the Pop Health team. So the Population Health Service was launched in the spring of 2020 and developed the COVID Assessment Risk Evaluation Program, which we refer to as the CARE program. And the program was essentially developed as an emergency response to COVID-19 in the Toronto shelter system back in the first wave when COVID initially started and hit the Toronto shelter system. This team has been diverse and encompasses a variety of individuals that have a very vast background, and they include population health physicians, family doctors, data analysts, health promotion specialists, and myself, who's the nurse, and Grace, who's our wonderful coordinator. The Population Health Service has developed into an essential service that we think is really trying to mitigate the risk of COVID-19 and the spread, and also promoting vaccine work and other health promotion strategies as well across the shelter system. We're working with 144 shelter programs across Ontario and 4,900 clients, and we're supporting with ongoing care, immunization, and recovery from the COVID-19 pandemic. And if we can have the next slide, please. Perfect. So what we do and how are we working towards these goals? So the COVID, there's three big categories, but one of the biggest categories is COVID-19 prevention and mitigation. And a lot of that work involves meeting with the shelter partners, going on site and conducting assessments, asking them what they need support with. And just like every shelter is different and unique, and every setting is unique. So how do we provide that individualized support that's needed on the ground to make sure that their site is safe, their staff are safe, and the clients are protected against COVID-19? And a big part of our work is also using data to think about who is at highest risk within these shelter systems. So our wonderful data analyst will work with the shelter site to identify folks who are older, who are at higher risk for COVID-19, and how we can best protect them with the space they have and with the resources that are available to the shelter, and also making sure that the shelter is able to identify those individuals as well. Another big component of what we do is health promotion. So talking about IPAC, talking about immunization, giving resources to the shelters, and making ourselves available as a health promotion tool to be able to go on site, promote, talking about COVID-19, about vaccinations. And then the last piece is immunization planning. And that's something recent our team has taken on. So we're discussing with shelters how best to roll out the immunization plan with COVID-19. This population specifically can be really vaccine hesitant. And so how do we address those challenges? We also work with sites to see what challenges that experiencing on site, what are they hearing from the clients, and how we can best address these. And again, using data to think about who are the most high-risk individuals at the shelters and how can we get vaccines to them. And I will turn it over to Grace.
So I think Tina did a great job in kind of summarizing what we do, and I'll just talk about the components and break them down. So in terms of COVID prevention and mitigation, one of the components that we do, as Tina said, is very data-driven. And so the risk stratification component is a big part of our work. So we work closely with staff that know and work with the clients in order to assess their health comorbidities, their mental health risks, their substance use and support needs. So we look at the risk of COVID complications, but we also collect other information because we hope to progress forward and actually support sites outside of COVID. And we'll get to that at a certain slide. But that is one of the components that we use. And so in the risk stratification, we can identify the risk distribution of clients from high risk to low risk. And what we then do is we create a line list for the shelter staff to utilize. We also create graphs and visual representations of this data and provide an aggregated representation of the shelter and how it compares to other shelters within our data in terms of their risk, their client distribution. And so what is this data used for? And what we do with this data is we actually share it with the shelters, and they can use that to support those who are in need of the most shielding and protecting now that they've been identified with added services. And it can also be used as advocacy for added programming and further funding and supports. And another thing that Tina touched on is the site consultation component. We understand the diversity and the complexity of each site. It's kind of its own ecosystem. So it's really important for us to come on site and understand the site-specific needs. And what we do is we provide IPAC support. We do a site walkthrough. And we obviously have it be a co-created solution and co-created support system. So in terms of, room changes in room allocation, cleaning habits, all of these are co-created together with the shelter site. The thing we don't want to do is impose solutions on shelters that might not be feasible. So really try to come on site, understand what the site looks like, understand the clients on site, because that really helps us in talking about the next step, which is the outbreak support. So whether it's preparing or trying to prevent an outbreak or dealing with an outbreak, really use the risk stratification data and an understanding of the site to help with outbreak supports. So that involves creating a pre-outbreak or pre-support plan, and that entails, getting a better understanding of what's required from the mass testing, all the documents that are needed to be put in place, like a line list of the clients on site, and we also create a post-testing plan. So possibilities of isolating on site. We work with the shelters as well with any sort of referrals that they need to a recovery site. So we try to prepare the site as best as possible to deal with the outbreak before it happens and while it's happening. Another component is the targeted testing. So a lot of the times, as you know, there is some hesitancy with testing. And so we try to come on site and make it as low barrier as possible, which is why we focus on using saliva kit testing. And so we bring the saliva kits in, and Tina has been spearheading this wonderfully with some of the other nurses that we have on our team in terms of, being on site, having a relationship with the clients, understanding who the high-risk clients are, and ensuring that they are tested and well protected. So I'm going to move on and talk about the health promotion component as well. So an important component of the CARE program is providing resourceful, accessible, and accurate health promotion, knowledge, information, material related to COVID. We want to make sure that the clients, the staff are informed and have all the information needed to guide their decision making. And it's a foundational part in terms of COVID prevention and mitigation, especially when we're talking about immunization uptake and further recovery from the COVID pandemic. So what we do on that front is we do customized services. So we offer individual, legible, one-on-one consultations with the clients. And that's where the risk stratification is really important, because we identify who the high-risk clients, we work with the shelter staff to identify the folks, and then we meet with them one-on-one to talk about any questions they might have about COVID, any questions they have about their health conditions. And we also try to, dismantle any sort of misinformation related to COVID. Another really important component is the Health Ambassador program that we're hoping to create, and it's a foundational part of our current services right now. And it's a primary asset in terms of the folks that are health ambassadors are hand selected by the shelter staff themselves. And they could be people with lived experience living within the shelter system, or it could be staff that are very much engaged and interested in mitigating COVID. And so what they do is they're positioned to actually spearhead the development, dissemination, and utilization of the health promotion material that we create. And we work closely to co-create and adapt these resources to address any gaps that they identify. And so the health resources is a really important part of our work, and it is focused on COVID education and immunization, and we hope to really expand it to address other sort of components. The foundational part really is having these documents co-created and translated in a way that's accessible to a multitude of different audiences. So I'm going to pass it on to Tina to talk about the immunization planning and the immunization part of our work.
Another piece of work that we've moved into recently as immunization has been rolling out into the shelter system is immunization planning. Through our work with the CARE project, we've built really good relationships with our shelter partners, which has allowed us space to also help with immunization planning. And historically, as everyone is aware, shelters and clients within shelters have had lower uptake of immunization for a multitude of reasons, whether it be mistrust for healthcare professionals or mental health concerns and many other factors that play into this. We've been supporting with our partners how we can increase immunization uptake for immunization, what kind of hurdles questions may come up from clients, and what is the questions that are going to be asked by clients that we can address specifically regarding to vaccine hesitancy. And then we work with some of that pre-gathered data and go on site to do some health promotion. So whether it be, depending on the site, and again, that individualized approach. So what kind of materials do we want to bring? What kind of client population are we serving? Is this youth? Is this adults? Is this older adults? And really targeting our approach depending on that for the materials we choose and our approach to the on-site promotion. Usually that'll involve one of our nurses, myself or another nurse, going on site and talking to clients and addressing any questions or concerns they may have about the vaccine, and really approaching it from a patient-centered or client-centered perspective, and just making sure we understand their concerns and how we can best address them. And then we're always involved in the post-immunization huddle, so where we learn about what the uptake was of the vaccine, what were some challenges experienced by staff and clients, and how can we, in the next round, address some of those concerns. And again, really taking an individualized approach to each shelter as their unique ecosystem, and each client even sometimes, to address these concerns. And a big part of it is also using our care data and our line list, like Grace mentioned, to target those older folks that are at higher risk. So identify those people and do a little bit more outreach to make sure that they do know about the vaccine, and they do know that they can get it, and address those questions because they are the ones that are more at risk for COVID complications. And so working with the next slide, working with people with vulnerabilities, of course, this is a huge factor in our work, and we just really have to be mindful of the health promotion materials and the language that we create and we use, as sometimes what's used in the general public doesn't always work for the clients in the shelter population. So how can we make sure that the materials we're using are suited for the site, and again, a very individualized approach depending on who's on site and what the population is. And community engagement, and Grace spoke to this a little bit with the health ambassador program. So how can we utilize those who already work with this community and are in this community to really empower this community to be able to take COVID-19 and help solve the problem with the community. So something like improving vaccination rates. If we can work with someone who is part of the community, or a health ambassador that really knows the clients well, that really understands the needs of the community, it's more likely that we're going to get better uptake. So a lot of other work that we've been doing is sort of working with the community and increasing engagement, and also in turn through that empowering the community as well. And this is going to show some of our work as well, like doing the saliva testing. We work with shelter providers to do the saliva testing together. So it's been wonderful to see how much our shelter partners have been engaged in the process, and how amazing, this is very new for them. I mean, we're in healthcare, so we're very used to this, but this is something that they've really taken on and worked with just to make sure that their clients are safe. So the empowerment piece has been really huge when it comes to COVID and protecting clients, and it's even bigger with vaccines. And I'll turn it back to Grace.
Thanks, Tina. So I'm just going to touch on the long-term goals. So we hope to further develop this program to modify the materials and resources to move beyond COVID-19 and hold commonplace a community-based health promotion model that's focused on empowering people within the shelter community to co-create models of information sharing and knowledge translation that fits their unique needs. So we hope to have the health ambassadors an embedded part of the shelter system to create space for community and trust building and accurate information sharing tailored to the diverse needs of each site. And we hope that that's really going to enhance immunization uptake, not just with COVID immunization, but beyond, and help, with any sort of preventable diseases that might be experiencing outbreaks in the shelter system. Another foundational goal, and this is something I'm sure a lot of people can relate with, is ending homelessness. And what that involves is really having housing that complements the individual support needs. And that's where the risk stratification is important, because we also have a housing component. In order to really end homelessness, we need to focus on the people who need that most and needed support, and figure out what supports, what type of environment is needed to help actually improve their situation and actually lead to them thriving. And the risk stratification is also foundational for being able to serve from an evidence-based perspective and help that be a guide. As you know, with people experiencing homelessness, they're not usually studied, and that could be really largely because of the transient nature of this population. So we're very grateful to be able to have this data and really share it with the site and co-create solutions together. And so in terms of, that's kind of the end of it. And if you have any questions for me, so we'll just move on to the next slide with the questions. If you have any questions, please let us know. And we're very excited to be here and answer as best as we can.
Thank you, Grace and Tina. And as Grace just shared, we're open for questions. We have time and space for that today. So invite you to add those into the chat box. While you're doing that, I'm going to maybe jump in with the first question. And you talked about something really important in terms of engagement, but also co-creation and not imposing solutions, whether that be on the shelter, on the clients, on the staff. And that really struck me. And I'm wondering if you can talk a bit more about how do you ensure you do that? What are the checks and balances that you put in place as a team along the journey to ensure that we're not entering into imposing solutions, and that it really is working for the space that you're serving?
Yeah, I think that's a great question. And one of the most important things that we consider is having representation. So having a diverse group of people being involved. And I'll just say, for the ambassador program that we're actually working on and developing at the moment, we don't have a set plan. We don't know how it's going to look like. And we don't want to know what it looks like until we have all the ambassadors and all the different partners a part of it, so we can have a conversation, because we only have our lens of perception. And it's really important to have a diverse perspective before we go ahead and co-create any sort of programming. And that for me and for our program has been a really important part of ensuring co-creation is happening versus imposing solutions.
Thanks, Brian. I think you might be on mute.
I just noticed that. Just to follow up on that question, the co-creation model is such an interesting approach to take. I'm wondering if you've noticed any challenges in trying to do that kind of co-creation work, and what some of those challenges might be.
Yeah, so some of the challenges would be to really find, to come together and find the right group of people, because we're working with, our partners, and they would have to identify who the best folks are and bring them together, and obviously ensuring that they are paid and compensated for their services. So these are some of the challenges, just the onboarding and the beginning process. And then afterwards, once we have that, I think we'll be able to move pretty quickly forward in terms of creating this program and have it be a truly co-created model of service.
Well, we're talking about co-creation, because I do think it is such a critical component of what you're talking about. One of the things that I've often struggled with, and heard this from others as well, is that pressure between co-creation, but also the pressure of the pandemic, or whatever that crisis is that's in front of us. So there's this pressure to act, which I think can sometimes lead us in the wrong direction, and things like paternalistic approaches, etc. So How has your team balanced that? And what have you found kind of works to make sure that immediate needs are being met, but that you really are engaging in those co-creation engagement practices?
I think what our team really tries to do is kind of put our services out there to the sites and then, give them some space to think about it if they really want to be a part of care, if they really want to take up some of the services. And so not sort of walking in and saying, this is what we do and we're here to help, but really sort of letting them kind of figure it out, see what the work is. And then usually we'll go on site and have a really frank conversation about what the needs are. So kind of a needs assessment for the site, see what you're struggling with, and then we kind of go from there. So I think having sort of a very open-minded approach when you walk into a site and say, let's just sit down and think about what your needs are right now. And sometimes there are times where you're like, oh, I see a different need here, but you really have to kind of work together to first understand where they're coming from and then maybe bring up some of your own ideas. But really ultimately it's up to the site to uptake those, and anything we do send out is pretty much always a recommendation, so it's never imposed. But let's just see if this works for your site. If it does, then let's try to put it in place, and then we're there to support the whole time as we do recommend things to make sure that it's actually working for them. And if it's not, then what else can we do? So I think it's a new space and we're definitely inventing the plane as we're flying it. So that's always what we tell the sites too. Like, we're also just trying to work with you and to see how this can best go. So let us know if there's anything that's not working or what is. And so that kind of approach I think has been really helpful. And we've had partners come back and ask for other services and things when they do feel like, okay, this is working for me. Like, what else can I do now?
Yeah, I think Tina answered this beautifully. And I'll say that we have a menu of different services, and choosing one does not prohibit you from choosing the other, and you don't have to be a part of all of it. And I think that really adds to that, what Tina was mentioning is really, like you said, Lindsay, we can't always, wait for something to happen in order to create a solution or a plan. So when we create a number of options and see which ones fit and which ones can be modified and utilized for the different services.
That's great. Another area that I wanted to touch on, I was curious when you were talking about vaccine hesitancy and reaching especially vulnerable populations. Are there some key areas that you're noticing that are causing vaccine hesitancy? And could you elaborate a little bit more on what those are and how you're addressing them?
Yeah, there are definitely some trends that we've started to notice. I mean, one of the biggest challenges is definitely mistrust of the medical profession and medical professionals, just because, historically, and the experiences that they've had when they've encountered healthcare. So I think working together with the site to see how can we address those, and it really is an individualized approach. Some sites are really large and the outreach looks a lot different than some other sites which are really small and have a lot of older folks. So thinking about talking with the site about what are the concerns for the clients and how can we address them. So sometimes going one-to-one, door-to-door to answer questions. Sometimes it's more like everyone's really engaged and they just want to know more, and it's a presentation. Another big challenge is definitely mental health, and that's something that we just have to work with and bring a really trauma-informed approach. And again, using the health ambassadors is probably key, because my perspective is so different than what a peer or a community worker's perspective is going to be, who knows the clients really well, and bringing in folks that they really trust to give good information, I think is a big way that we've been trying to address this as well. So not ourselves being there and saying like, hey, listen to us, like this is what we think about the vaccine, but having people that they know really well ask questions, and then taking a really non-pushy approach, as in like, please ask questions if you're interested. We understand if you decide not to do it. So a very non-judgmental approach to this whole thing, and just letting people decide for their own.
Thanks. I really like the relationship-based approach and meeting people and organizations where they're at. We've got a number of questions that have come through, so I'll maybe start with the first one here, is to give a bit more information on what you mean by saliva tests. Can you walk us through that?
Yeah, I can happily do that. And Tina, please add where I might be missing. So what we do is we actually order the saliva kits from Public Health Ontario. Anyone has the capacity to do that. Any shelter can order their own rather than having, let's say, a hospital come on site and do the testing. So we have a number of saliva kits that we keep, and all of our partner sites have the capacity to access them. So what we do is when a mass testing happens, but the numbers are not very high, we can come on site and actually do saliva kit testing with the high risk clients and any other clients that might be interested that might have been missed in the mass testing. And we get the line list of clients that were tested to help guide us and make sure that there's no duplicates. So once the saliva kits are used, which is a very easy sample to collect because anyone can do it. It's been done in schools. Teachers have been collected because you just spit in a little cup, you put it in a biohazard bag, and you can hand it over and send it to Public Health Ontario for processing, and then you would get the results. So that's another added component to empower the sites in order to make sure that anyone who needs to be tested and collected can be doing so, especially for people who work that might not be there during the day when the mass testings tend to happen. So we try to give a diversity of options so that anyone who needs to be tested has the capacity to do so. I hope that answers it, and please let me know if there's anything I can add.
I can definitely speak a little bit more. So I guess as the pandemic progresses, there's a lot of burnout in terms of the NP swabs and sometimes a lot of resistance. And when there's a large outbreak or even a smaller outbreak on site and they're trying to understand the magnitude of it, just like vaccines, there's a lot of hesitancy around mass testing and testing as well. So sometimes having someone they know from the shelter or, a more individualized approach, having the client being given the saliva test is a little bit easier to digest and they're more likely to do it. So that's sort of what we've been offering recently as well.
I think there's a few of us on the call who don't know a lot about the saliva tests and whether they can detect for variants, and is it asymptomatic testing or symptomatic testing that you're doing?
Ideally, it's asymptomatic testing. The hope would be that if they were symptomatic, because shelters do screen their clients every single day, that they would be sent to a CAC right away. But sometimes they are symptomatic, so you can test whether asymptomatic or not asymptomatic. It's not as sensitive as the NP swab, but it's another option, and it does detect the variants.
Okay, and I think that same individual is asking, do you know if saliva tests are available across the country? I know you're speaking to Ontario, and if you don't know this question, we can definitely find out and loop back to the group. But are you aware of what the spread is across the country?
I don't know about the country. I know that they're offered in Ontario. The new 2021 rec has saliva, like the neat saliva and then the swish and gargle as options that you can select when you do a COVID test. I believe it was sick kids that initially started it because kids have a hard time with the NP swab. And that's how we sort of kind of started getting access to it and realize it has actually really better uptake compared to the NP swabs. Or if you give people an option for both, you're more likely to have someone take a test.
And we have another question in the chat, and that is, do you have recommendations for innovative ways to continue to provide services and support to clients during an outbreak based on what has worked for the sites you are working with?
That's a really good question. And this is a struggle because most sites have shut down sort of their programs where clients have to congregate or meet. A lot of things have been moved to virtual. And so sometimes we do recommend if you really have to meet with a caseworker, you do have to meet to continue a service, meet outdoors, make sure they have a mask on, those kinds of things. And I think really educating the staff about, what are the parameters and how you can meet best so you can still provide those services goes a long way. In terms of clients, I know it has been a challenge and the staff at the shelter sites have really tried their best to make sure that all the services they need access to are still available in some capacity or not. So I think my recommendation would be just as much to reach out to service providers to make sure that they can provide services as safely as possible. And if they can be moved to virtual, how they can do that so they're still effective. I know a lot of sites have, done wonders with setting up rooms where they can connect clients and their workers or whoever may be providing support to them. So it's virtual and they're happy to take appointments and set those kinds of things up. So if a site is willing to do that or has capacity to be able to have those kind of virtual meetings in the shelter, that's also another option to look into.
Thank you. And we had one question from the group as well, which I'm sure is a common question is, are you able to be contacted by folks who've attended this webinar with questions or requests for resources that you may be willing to share?
Definitely.
Great. So your information is included in the slides in terms of your emails, but we'll make sure that after today's event that those slides and the webinar recording are shared out with the group so they can reach out to you with any questions. So just to let everyone know, we will absolutely share that information. It usually comes out within a couple of days from our team.
Great. Another question in the chat is, do you have any recommendations for using nasal swabs when saliva tests are not available?
Yeah, so that's pretty much the alternative. If there's no saliva test available, then the nasal swab is what clients get offered.
It does look like there's potentially parts of the country that the saliva kits are not available. I'm seeing that it looks like in Quebec. There is some question in terms of availability, so good to think about for those who may not have access, what those options are. And I'm just looking through if we have any other questions. Ryan, are you seeing anything that we've missed?
No, I am not.
Okay, I think I have one question in my list here that I may have missed, which was how to make sure, and if I've misinterpreted this question incorrectly, please correct me in the chat box. But for those who are vaccine hesitant, how to make sure that there's not a duplication of efforts in speaking with them multiple times. So are there any specific kind of experiences you've had that you could share with the group in terms of supporting folks who are hesitant?
Yeah, I find that usually touching base with a shelter manager or provider, because it's usually likely that they've already had these conversations. And so when they're asking for additional support, it's sort of to address any of those questions or concerns. So maybe just touch base with them to see what the needs again of the clients are, what kind of questions they're asking about vaccine hesitancy. And if someone's really resistant or, is going to get upset that they're being approached multiple times, then that would be a person that, we sort of kind of let them be and come around to it if they're willing. But I think just always like letting people know that, our door's always open if you're ever have questions, concerns, whatever. And that's sort of how I think we've been addressing it so far. So I think just the sites really know their clients really, really well, and they've had multiple conversations with them before I think our team even steps in. So we always touch base with them first.
And another question related to vaccine hesitancy is, are you having to deal with vaccine hesitancy among shelter staff?
Yes.
And how are you dealing with that?
Yes, I mean, anecdotally, most sites have been hearing about like a 50% uptake among staff. And the way we're dealing with it is it's, again, everybody's decision. And I think we're providing shelter providers resources. And again, some of the times we'll be doing webinars at staff meetings and also attending. They've been collecting questions anonymously that we've been answering, things like that. To address those questions and concerns. And yeah, I think the uptake has been pretty good for the most part, but there is definitely resistance among shelter providers as well. And I think the shelter managers and the shelter system is really trying to give them the resources and the space to make their own decision and keep that door open if they ever do want the vaccine.
Thank you. Before we wrap today's webinar, I do want to hand it over to Ryan to, I think, just ask the group if there's any other learning needs that we haven't touched on today that we'd like to talk about. So Ryan, over to you.
Certainly. So when you came into the webinar today, we had a poll. We were asking people for their priority areas, and it looks like supporting people in the workforce is like clear margin, the winner on that front. And also harm reduction is kind of a secondary area. What we wanted to do is do a quick poll to see if those are still the areas that you wanted us to focus on, based on the conversation today from what you've heard from Grace and her colleagues. So if we could just get that poll up. and it looks like it's a bit of a horse race going on. What we wanted to do is actually take the last few minutes of the webinar for those who can stay with us, is to get a sense of what areas you feel might be ones that you want us to focus on for the learning series. So right now we have 46% saying yes, that supporting staff and harm reduction are probably the two areas that we need to focus on, but 54% are saying no. So if you could let us know in the chat function what areas you think we should focus on and any specific topics that you'd like us to cover, that would be very helpful, because we're hoping to make this as much of a co-creation model in terms of bringing the learning needs that you're requesting to this webinar series. Given the national scope of virtual support, knowledge sharing focus of what is working. So that's something that we've heard very much during this process, that it's everything from a regular webinar series to more focused one-on-one coaching. So we're getting a really strong sense of the learning needs of everyone who's participating in the program. The next, yes. And then if you could let us know what your priorities are for the next webinar, that would be great, because we want to try and make this as useful to you as possible and to bring you the information that you really need. One comment is if a significant amount of time is being spent on a particular topic, could we hear from other provinces as well? That's a great suggestion, because I think that different provinces are experiencing different issues depending on how their health systems are structured. So for sure, we can look for speakers on topics from different provinces to get different perspectives in terms of how they're dealing with those learning needs.
One of the other learning needs, Ryan, I saw come through is in regards to how do we support peers in their work in this setting. And I know you and I have had some conversations offline about that work, and certainly in the work that CCSA is doing. So I think that's a great one to make sure. Sounds like there's support for that. So thank you for raising that.
Great. Another one that we have here is accessing vaccines for clients who are not in shelters but meet the Canadian definition of homelessness, especially those who are not able to attend a clinic. So that's great. That is something that we've heard throughout the learning survey, that there's concerns that because people are usually in multiple systems, if they have concurrent disorders, for example, that there's concern that they may not actually hit the right system or the right spot at the right time. So we'll definitely keep that in mind. Another one that's come up is in a residential facility where rooms are like a dormitory, how to handle an outbreak, tips and anecdotes. This is in BC. We're also hearing this from other provinces, so it's certainly something that's on our radar. And it goes back to one of the things that we heard in the survey around planning for and developing manuals and procedures and really planning for those outbreaks before they happen as much as possible, especially with surge capacity issues. So that's certainly something we can look into. Post-vaccine behaviors of residents and staff to maintain safety versus reckless abandon. So that's another area that we can certainly look at. Supporting clients who are youth, do not qualify for vaccines, and are not able to socially distance from peers or family in a residential addictions facility or shelter, how to keep staff in these facilities safe. So I think we're hearing loud and clear about the safety of staff and clients as a key area for us to focus on. Lindsay, are you seeing anything else that I'm missing?
Ryan, the only other thing that I wanted to note is we got a message through about how we support marginalized staff that remain overrepresented on the front lines, and really thinking about how do we best support these groups. So thank you for that comment. I will maybe add in, if you are implementing innovative practices or pandemic response programs that you think are worth sharing with your peers, and you have the capacity to do so, we would be really interested in hearing from you. So just let us know in the chat box. Our emails will be shared out, but we really do want to share out those early learnings. And at this point a year in, I think there's lots of wonderful things happening across the country that others could benefit from hearing about.
Absolutely. We see this as your series to learn from your colleagues. So we're happy to facilitate those conversations. Another area that just came in the chat box: has anyone considered the potential litigation that agencies may experience from staff or family members if we do not require vaccine, similar to LTD, where individuals have self-selected out only to litigate against the agency, who then has become liable and required to pay out substantially? So that is an area of concern that we've heard a bit about in terms of the legal ramifications of whether to vaccinate or not. It's a bit more of a challenging area because the legal sphere is very confusing and very dependent on specific situations, but it's certainly something that we can take back and discuss and figure out if there's a way to address it in a global or national way. Any other areas that people would like us to focus on? Okay, so I think we have some ideas, which is great, and we will take those away and figure out how to best approach these. I think that what we're hearing is safety is still a big concern for everyone, and learning from each other on how people are planning to manage outbreaks and prevent outbreaks is a key area for us to focus on, and also to look at a provincial lens so that we can bring different perspectives to the table. So we will certainly do that for the next opportunity. And it looked like people were pretty much, April or May was kind of a 50-50 split. So we will take that back and figure out our next webinar, hopefully for April and May, and communicate that out to everyone as soon as we can.
Thanks, Ryan. And all of those registered for today's event are enrolled in the learning series. So you'll receive an update once each event is scheduled. You'll see that come out to our team. All events are optional, but we will share the recordings with you afterwards so that you have access to those. A special thank you to our speakers, Grace Rishandi, Tina Kaur, for sharing so generously of their time, talent, and their experiences. We'll make sure you get their contact information so that you can tap in to that expertise as well. And be sure to take a few moments to complete the feedback polls on your screen and reach out to us if there's anything we can do to support your learning needs around this journey. Thank you so much, everyone, for joining us today, and goodbye for now.